and welcome to the video of the vasculature of the head and neck. I am Tanya Chamberlain from the Division of Anatomy here at the University of Leeds, and in this video we will be looking at the arteries, veins and lymphatics of the head and neck. So let's have a look at the learning objectives we will cover in this video, and use these as a checklist for your learning to ensure your engagement with the material. We are going to be looking at the arteries supplying the head and neck with reference to three main branches and their subsidies: the maxillary, facial and lingual arteries. We will also have a look at the corresponding veins, and finally the lymphatics of the face and neck. So let's crack on and look at the arteries. This image represents a sketch of the anterior neck, and firstly we need to remind ourselves of some of the existing anatomy that we have looked at. Here is the trachea, or the windpipe as it is more commonly known. It bifurcates at the level of the sternal angle into two bronchi, the left and the right. Here we have the beginnings of the respiratory tract, the larynx. This is our voice box, and in a later video we will look at how this piece of anatomy helps us to phonate, that means talk, but also how this part of anatomy helps to protect our airways by preventing the aspiration of food, drink and saliva. On the thyroid cartilage, we have half of the thyroid gland. This incredibly important gland is used to secrete hormones for a variety of functions throughout our body. Here we have the hyoid bone, the only bone in our body that doesn't articulate with any other bone. This free-floating bone in the neck helps to lift and support the larynx during swallowing, to prevent the inhalation of food into our respiratory tract. Now we have covered the anatomical landmarks, let's have a look at what we've come for: the vessels. The first and very important vessel is the one coming directly from the left ventricle of the heart. This is the aorta. There are three parts of the thoracic aorta. We have the ascending aorta, the arch of the aorta, and the descending aorta. But the one we are interested in today is the arch of the aorta. This large vessel carries oxygenated blood from the heart to the body. On the most superior part of the arch of the aorta, we have three vessels. The brachiocephalic artery, which is the first branch, and immediately moves off towards the right-hand side of the body. Then we have the subclavian arteries. The right subclavian comes from the brachiocephalic artery, whilst the left branch comes directly from the arch of the aorta. These arteries travel down their respective arms to supply the muscles of the arm, forearm and hand. And the root of all the vessels that we are going to look at today are these beauties, the common carotids. On the right, this also comes from the brachiocephalic artery, whilst on the left it is the middle branch of the three of the branches arising directly from the arch of the aorta. They are called common because in anatomy we like to name things with multiple similar branches as common. So the common carotid artery bifurcates at the level of the laryngeal prominence, or Adam's apple, into the external carotids, which stay outside of the cranium and supply most of the face, and the internal carotid arteries, which travel up to the cranium and supply the brain and a few other areas. Let's go and look at the course of this internal carotid first, as this is the simplest of the two, where we need to consider the vasculature of the head and face. So this is a lateral sketch, and I appreciate it looks complicated, but it is my job to show you how to unpick the complicated parts of anatomy and make them simple. You should also note that we will be looking at this picture in a short while when we consider some of the anastomoses of the arteries, but more about that in a few minutes. For the sake of orientation, let's recap some of the vessels we've looked at already. Here is the common carotid artery. We are looking from the left-hand side of the face. So this one has come directly from the arch of the aorta. But I could mirror this image and the rest of the vessels would look exactly the same. So from this point onwards, it is important to know that all of the vessels are paired. That means we have one on each side of the face and neck. The only exception to this is the brachiocephalic artery, which we will not be discussing any further. The internal carotid is the internal branch, so it is deep to that of the external carotid. The internal carotid is going to travel within the cranium, or the brain box of the head. It terminates at the middle cerebral artery and changes its name and direction to supply the brain tissue. We will revisit this artery later on in the programme, but for now we will look at the other branches of the internal carotid. Such as this one here, which is the anterior cerebral artery, which is also supplying brain tissue. And we have the ophthalmic artery, which is going to supply the eye before it becomes from behind the eye and supplies the forehead region of the head. It's not quite the full story of the internal carotid, but it will do for now. So let's go and look at the learning objectives before diving into our next stop on the journey. We have had a brief look at the internal carotid, so let's look at the more complicated arteries of the face. You'll appreciate that these arteries of the face are very important, so we'll go into much more detail for these arteries. As promised, it is more complicated, but that doesn't mean we can't unpick what we see. This is the external carotid that comes from the common carotid. And you'll notice that we've switched the sides of the head again. So down here, you can also see the brachiocephalic trunk. The first branch that we are going to look at is the lingual artery. This one here is the lingual artery. If it is the lingual, it must have something to do with the tongue, and that is exactly what it does. The lingual artery travels with the hypoglossal nerve to the tongue. The artery supplies the tongue, the sublingual gland, the gingiva and the oral mucosa of the floor of the mouth, whilst the lingual vein, as seen on this image, drains the blood from the same region. The arteries and the veins have a superficial and deep branch. The next artery is slightly more complex, so let's go back and have a look and see what comes after the lingual artery. This is the facial artery, which runs from the external carotid and travels under the inferior margin of the mandible where you can feel its pulse, before it runs obliquely across the face, giving off branches along the way. It gives off an inferior labial branch that runs deep to the bottom lip, and a corresponding superior branch that travels under the top lip. The facial artery then continues underneath the orbit and terminates as the angular artery on the side of our nose. The next artery of interest is the maxillary artery, which can be seen here. This is the artery that supplies the muscles of mastication and also the teeth. There are a lot of branches with this one, but we won't cover them all. This one is probably the most significant, and it is the middle meningeal artery. When we look at the skull, we see the pterion. That is the suture between the temporal, parietal, frontal and sphenoid bones. This area is very thin and vulnerable to fractures. This is where the middle cerebral artery runs immediately deep. Damaging this vessel can lead to catastrophic brain bleeds. We will revisit this artery briefly when we look at the anastomosis of the vessels. An anastomosis is simply a joining of two vessels from different origins, and there are a lot in the head and throughout the body, but we're only going to concentrate on a few of them at this time. Let's call it a taster of things to see for when you progress throughout your programme. This is how we left our image of the internal carotid course. We have the common carotid, the internal carotid, the ophthalmic and the anterior cerebral and middle cerebral arteries. Here is the external carotid artery. That gives rise to the maxillary artery. And the main anastomosis is with the red meningeal artery shown here and the anterior cerebral artery. The facial artery from the external carotid eventually anastomoses with a branch from the ophthalmic artery as they leave the orbit on the side of the nose. It is important to know that anastomosis of vessels gives us a backup plan if one vessel is blocked. An alternative blood supply can be created. But it is also important to know that damage to a vessel will have a knock-on effect on numerous other vessels, which is why we still have to be careful. Let's recap our learning objectives now that we have reached the end of the arteries that we are currently interested in. So at the end of the arteries, the next thing to tackle is that of the veins, which thankfully aren't that complicated. So, veins, because of their nature to drain, start at the distal region and travel to the bigger region, collecting more and more blood and therefore getting larger and larger as they accumulate. The first ones we're going to look at are the superior alveolar veins, which come as a posterior and anterior variety that drain the molars and incisors respectively. But we also have an inferior alveolar vein that travels within the mandible, draining blood from the mandibular teeth as they pass up to the maxillary vein via a plexus of veins sat near the pterygoids, so these are therefore called the pterygoid venous plexus. This directly communicates with a cavernous sinus, a huge vein-like structure within the cranium. It is suffice to know that the pterygoid venous plexus directly communicates with this cavernous sinus, and therefore there is a potential for the spread of infection from the pterygoid venous plexus directly into the cranial cavity and nerves found within this cavernous sinus. This will be relevant if a patient presents having recently had dental work involving a superior alveolar nerve block, as the superior alveolar nerve block that dentists target runs incredibly close to this venous plexus. The maxillary vein drains into the retromandibular vein, which combines with the facial vein to form the common facial vein that drains into the internal jugular, whilst the anterior portion of the retromandibular vein drains into the external jugular vein. Let's go and recap where we are in the video. We have looked at the veins and arteries, so now let's go and look at the lymphatics of the head and neck. As blood is forced under pressure through capillaries, fluid leaks out through the thin vessel walls into the surrounding tissue. Although this is a key means of delivering dissolved nutrients to tissues, it creates a problem. How do we remove the tissue fluid and return it to the bloodstream? The lymphatic vessels serve this purpose. They are a network of fine vessels found throughout most tissues, the brain being the most notable exception. They travel through the body, coming together to form progressively larger channels before finally depositing the tissue fluid they've collected, which is called lymph, back into the veins at the base of the neck. The lymphatic system also plays a central role in immune surveillance and response. Studded along the length of lymphatic vessels are sacs of immune cells. These sacs are the lymph nodes. As the lymph filters through the nodes, any foreign antigens, for example microorganisms, are likely to be detected by the immune cells within them, triggering an immune response in most cases. Although the lymphatic vessels that connect them quite often are very fine and difficult to see, the lymph nodes are much easier to observe, typically being a few millimetres in diameter at least. Nodes tend to be found in somewhat of a predictable arrangement. For example, there are small clusters of lymph nodes around the base of the head, tucked under the chin, under the mandible, just in front of the ear, near the mastoid process, and near the back of the head where it joins the neck. This forms a ring of nodes in the superficial tissues around the head. There are similarly superficial nodes running with the external jugular vein just under the skin below the ear. We have now reached the end of the video, so let's summarise the things that we have looked at. We have seen the major arteries supplying the head and neck, and been able to describe the arterial supply to the face with particular reference to the maxillary, facial and lingual arteries and some of their main branches. We can describe the veins draining the face. We have also had a brief look at the lymphatic system of the head and neck.